the palliative care in Africa is at a very interesting stage. There's been huge development in palliative care. There is increasing interest, but I think what is often missing is building the capacity on the ground. So one of the things we've been able to do as IAHPC board members is advocate, particularly with governments and with other institutions. My own institution is an academic institution. We've also been able to support membership. We've actually started to have a stall or a stand for membership at significant events, such as training events. So we've been able to sort of facilitate people from the African region getting engaged, getting involved, to access the resources online, particularly the research resources. That's very important in an African setting. We don't always have access to research, but also the training and scholarships. And I'm delighted to see that now Africa represents, in fact, the highest membership region for IAHPC. So I think we've been able to make a big difference. The opportunity to interact in an international way is fantastic. And we've seen a number of people who've come, who've been able to present their own research, but also see research in a global way. And it has inspired and encouraged them. And we're now seeing those people emerge as the future leaders for palliative care. I think one of the buzzwords these days is universal coverage and health system strengthening. And I think if you break that down in palliative care, I think that's the crux of the issue. We've developed fascinating models, amazing NGO ways of working, but I think we still have the challenge, particularly in weak health systems. How do we work within those health systems to develop palliative care? A good example of that is universal coverage. There's now good evidence that if you don't have universal health coverage, then you don't have economic health. And I think we in palliative care need to make those arguments much more strongly, that this is actually a core part of economic development and poverty alleviation, as well as actually good compassionate care.